Thank you very much, Saurabh. Thank you very much, Vanshika, and all our other panelists, Dr. Pramod Verma, Suresh Sethi, and Abhishek also is visible here. Of course, not live, but visible. So, and you know, it's a pleasure to be amongst friends because I have worked with most of you for many long years, and we are all familiar with the ground in which we are going to talk about today. I will not be really talking in detailed terms because in the 10 minutes of time, you can't really go deeper into any issue as such. But I'll just give you a little background as to how this whole journey of Aadhaar began. So the India has had a very serious problem of providing subsidies, help to individual families or even individuals. And the problem of duplicates and ghosts, like many other countries, was a very prevalent problem. And everybody was trying to solve that problem. But somehow it was eluding solutions. So in 2006, there was a group formed under the late Dr. Pranab Mukherjee, the then External Affairs Minister, to essentially, study this problem. And this was an IT department's problem, which is basically providing unique identities to BPL families of this country. This was the context in which this group was set up. And this group started working, and first they tried figuring out as to whether the existing databases, which are the PDS database, the BPL database, and many other databases, whether they could be used to construct a database which is unique and inclusive, unique and exhaustive in the sense that it includes everything. Now, this attempt was made, and Wipro was the consultant to that attempt, and they kind of did a lot of study and brought out multiple volumes of reports, and they figured out that only 26% of the overall data is a common data, which probably is everywhere same. Otherwise, because of the difference in names, difference in other kinds of things, it was not possible. So therefore, what this committee decided, what the group of ministers, actually empowered group of ministers, EGOM, decided that let there be a unique identification authority of India constituted, and they should be provided this job of creating unique identities to individuals. And this was decided in the end of 2008. And in January of 2009, the notification for Unique Identification Authority of India was issued. And then this authority started working actually from July 2009 onwards. And the authority had two basic issues, which actually, there were a lot of terms of reference, but two were very important. And this important part was create unique identities for every resident of India, number one. And number two was essentially to ensure that how do we provide identities to everybody. Because basically, if you create identity on the basis of some other identity paper, then it's a circular process. How do you bootstrap that process of creating identity for those who do not have one? And when we went into the question, the only thing which came out of this was that the biometrics is the only solution to ensure uniqueness. There is no other way to do that. So biometric came into the picture. And then we also realized that biometrics at that scale has never been done. Deduplication has never been done in the whole world. So it was in a way moonshot. It was in a way very unique, attempt which we were making. And obviously there are failures, possibilities of failures in such kind of attempt. Then the question was, what biometric do we collect? And then the question came, yes, we can collect fingerprint. There also we found out that fingerprints, that maximum accuracy, even of a European fingerprints, which are much more, probably sharper, our fingerprints are, because of the manual laborers and other things, they get really, sort of erased in some sense. Only 95% accuracy could be achieved, which means that out of a population of 120 crores, 6% of that, which is 5% of that, which is the inaccurate part, that is 6 crore. So the possibility was 6 crore people will continue to have more than one identity, one number. So that's actually a bad kind of situation. So we then went in for IRIS, and then of course we did a lot of POCs, lot of pilots in the country. Then we finally rolled out, and it took about 15 months to roll out the first Aadhaar number. We named it as Aadhaar because Aadhaar is actually a word which is in multiple languages of the country. And the first Aadhaar was rolled out on 29th of September, if I remember correctly, 2010. So which is just about 15 months or 14 months after this. So we took a lot of time in designing, then sort of creating an ecosystem of enrollment agencies. And the other thing which we did was our chairman, Mr. Nandan Nilekani, actually he evangelized this whole concept. He went out and met almost every chief minister in the country, and there was a bipartisan political support for this effort, and that is how this whole entire effort started. Then political support was there. We also actually experimented with a truly public-private partnership kind of architecture. This was the first project which actually assimilated a lot of the private people. Dr. Pramod Verma is the chief architect who is in this panel. He actually is a highly qualified person, doctorate from Cornell, I suppose. I don't remember the university, Dr. Verma. But he has been, and he is a top-rate architect in the whole country. So that is how we got Pramod, we got many other people, and because of Nandan's sort of influence in the private sector, we got a lot of these volunteers working for Aadhaar in the private sector. So that's another part which actually created a very agile structure, which actually ensured the rollout and also technology part, because it was largely a technology-driven project. Technology was working very, very deep into this project. So that's one part. Then, of course, this also actually brought out a number of lessons for us. One was how to do large-scale technology projects, because large-scale technology projects cannot be done, by some joint secretary sitting in some ministry, in some department. It cannot be done. It has to have a very, very special purpose, institution, an organization, which actually should drive and which should have a market-driven part. Second thing which we realized, this is the first project where the money paid was based on outcomes. It is not based on, how much effort you make. No, how much outcome you give me, then I'll give you the money. So we decided initially that we will give 50 rupees per Aadhaar number generated to these states or to any registrars. And we actually brought in private sector registrars, also the banks, the LIC, and many India Post and other things. Then this became the first project which actually, after a couple of years, we reduced the rate to 40 rupees per Aadhaar. Typically, projects increase in number, their budget estimates increase. We brought down from 50 to 40. And actually, we have, in that way, we have been able to generate and enroll, generate and communicate Aadhaar. And we gave 26 rupees to India Post per Aadhaar for delivering the letter. The total money is less than 100 rupees per Aadhaar. So while the UK's identity project was 135 British pounds per ID, our Aadhaar is less than £1 per identity. This is the cost effectiveness. So the number of, this is one part, outcome-based payments. Incentive alignment, everybody was actually aligned. The states were trying to maximize the number of Aadhaars generated. The enrollment agencies were trying to maximize. Even the enrollment agent was being paid on the basis of how many Aadhaar data he captured and how many Aadhaars his data generated. And therefore, it became an altogether incentive aligned structure. Then the next thing, which I think is very, very important, there should be no function creep IT projects have the propensity to do a lot of function creep, which means, they start with something, then they say, I can do this also, I can do this also. We ensure that we just do two things. One, we generate an identity number to each individual based on his or her biometrics, number one. So unique ID to every resident. Secondly, we said we will provide an authentication service. And these are the only two things which we will do. And that's the only two things which they do now. Of course, there are many flavors of authentication, which is electronic KYC and of course, e-sign, not e-sign really, electronic KYC or the authentication. And then there are multiple products which are collectively described as India Stack today. So this is how this whole thing is started. And we continued that we will say X is X. That's all. We prove identity. And this was the world's first project where identity was pure identity without eligibility. I mean, so much so that even citizenship was not included in this. So citizenship we considered as an eligibility, and determination of citizenship is a legal process. So we said, let's not get into that. So this is the identity without eligibility. And then this identity can be plugged into anything. And that is what is modular design, which is just plugged to every domain to provide service, because establishing identity was the common problem. And that point in time, people did not have identity. And believe me, there are 40% of the people who did not have any verifiable identity at that point in time. And they gave ration cards, they gave Mukhiya certificates and all that. So I think the Aadhaar has solved these problems. I'll stop here because I think I've already run out of my 10 minutes of time. Thank you very much for sort of inviting me to this. Aadhaar is a subject which is very close to my heart, and of course, I keep on troubling Saurabh with all kinds of, propositions, suppositions, and and kind of requests. But that's how this is. Happy to be here in this panel. Thank you very much.